Top 25 Registered Nurse Interview Questions and Answers. In this video, we will explore the top 25 interview questions commonly asked to registered nurses. Each question is designed to assess both clinical knowledge and interpersonal skills critical for success in the nursing profession. Additionally, we will provide detailed answers to help you prepare effectively. Whether you're a new graduate or an experienced nurse, these insights will enhance your confidence and readiness for your next interview opportunity. 1. Can you tell us about yourself and your nursing background? I am a dedicated nurse with over 5 years of experience in various healthcare settings, including emergency care and pediatrics. I obtained my Bachelor of Science in Nursing from a respected university and am currently pursuing additional certifications in critical care. My passion for nursing stems from a desire to help others during their most vulnerable moments. I thrive in fast-paced environments and enjoy collaborating with a multidisciplinary team to ensure the best patient outcomes. Outside of work, I volunteer at local health fairs, promoting wellness and preventive care in my community. 2. Why did you choose a career in nursing? Choosing a career in nursing was a deeply personal decision for me. From a young age, I was drawn to helping others and making a tangible difference in their lives. Witnessing the compassion and dedication of nurses during my time in the hospital inspired me to pursue this path. I wanted a career that combined my interest in science with my passion for caring for people. Nursing allows me to advocate for patients, provide comfort during challenging times, and be part of a team that works collaboratively to improve health outcomes. The dynamic nature of the field keeps me engaged and motivated. 3. What do you enjoy most about being a nurse? One of the most rewarding aspects of being a nurse is the opportunity to make a tangible difference in patients' lives. I cherish the moments when I can provide comfort and support to patients during their vulnerable times. Building relationships with them fosters trust, allowing me to deliver personalized care tailored to their needs. Additionally, the dynamic nature of nursing keeps me engaged and constantly learning. Whether it's mastering new technologies or collaborating with a multidisciplinary team, each day presents a chance to grow both professionally and personally, which I find incredibly fulfilling. 4. What are your greatest strengths as a nurse? One of my greatest strengths as a nurse is my strong communication skills. I can effectively convey information to patients and their families, ensuring they understand their care plans and feel comfortable asking questions. Additionally, I possess excellent critical thinking abilities, allowing me to assess situations quickly and make informed decisions in high-pressure environments. My compassion drives me to advocate for my patients' needs, while my attention to detail helps prevent errors in medication administration and patient care. These strengths enable me to provide high-quality nursing care. 5. What are your weaknesses and how do you handle them? One weakness I have identified is my tendency to take on too much responsibility, which can lead to feeling overwhelmed. To manage this, I have learned to delegate tasks when appropriate and communicate effectively with my team. I prioritize my responsibilities and use organizational tools to keep track of my workload. Additionally, I seek feedback from my colleagues to ensure I am not stretching myself too thin. This approach not only helps me maintain my own well-being but also fosters collaboration within the team, ultimately benefiting patient care. 6. How do you prioritize patient care during a busy shift? During a busy shift, I prioritize patient care by first assessing the urgency of each patient's needs. I identify those requiring immediate attention, such as those in pain or showing signs of distress. I utilize a triage system to categorize patients based on their conditions. Clear communication with the healthcare team is vital, allowing us to delegate tasks effectively. I ensure that I regularly check on all patients, even if they are stable, to monitor any changes. Staying organized and focused helps me provide the best care possible, even under pressure. 7. Describe your experience with electronic health records, EHRs. I have extensive experience using electronic health records, EHRs, throughout my nursing career. I have worked with various EHR systems, such as Epic and Cerner, which have enhanced my ability to document patient information accurately and efficiently. I am proficient in updating patient histories, medication lists, and treatment plans while ensuring data integrity. Utilizing EHRs has allowed me to communicate seamlessly with other healthcare professionals, facilitating better coordination of care. I appreciate how EHRs improve patient safety through features like medication alerts and reminders, ultimately enhancing the quality of care I provide. 8. How do you handle a medical emergency? In a medical emergency, my first step is to quickly assess the situation and ensure the safety of the patient and those around them. I prioritize calling for help, notifying the healthcare team, and activating emergency protocols if necessary. Once help is on the way, I focus on stabilizing the patient by checking vital signs and administering necessary first aid or interventions, such as CPR or controlling bleeding. Effective communication is key. I provide clear updates to the team and ensure that the patient receives timely and appropriate care. Keeping calm under pressure is crucial for making informed decisions. 9. Can you explain how you perform a patient assessment? When performing a patient assessment, I start by gathering comprehensive information through a thorough patient history, including current symptoms and previous medical conditions. I then conduct a physical examination, examining vital signs and assessing each body system. I engage with the patient to understand their concerns, ensuring they feel comfortable. Observations are documented accurately, and I utilize assessment tools as needed. Collaboration with other healthcare professionals is vital to ensure a holistic approach to care, allowing for tailored interventions based on the assessment findings. 10. How do you ensure patient safety during medication administration? Ensuring patient safety during medication administration is paramount. Firstly, I adhere strictly to the 5 rights of medication administration: the right patient, right medication, right dose, right route, and right time. I double-check each medication against the patient's chart, and I communicate clearly with patients about their medications, including potential side effects. I also collaborate with pharmacy staff to clarify any discrepancies. Additionally, I maintain an organized medication administration record and report any errors or near misses to improve processes and prevent future incidents. Keeping open communication with the healthcare team further enhances patient safety. 11. How do you handle a difficult patient or family member? Handling a difficult patient or family member requires patience, empathy, and effective communication. First, I actively listen to their concerns without interrupting. Acknowledging their feelings helps to de-escalate the situation. I remain calm and maintain a professional demeanor, ensuring they feel heard and respected. If needed, I clarify any misunderstandings and provide relevant information to address their concerns. In cases where issues persist, I involve a supervisor or a mediator to facilitate a resolution. Building rapport and showing compassion can often turn a challenging interaction into a positive experience. 12. How do you explain medical procedures to patients who don't understand? When explaining medical procedures to patients who may not understand, I first assess their current knowledge and any specific concerns they have. I use simple, clear language and avoid medical jargon, breaking down the procedure into manageable steps. Visual aids, such as diagrams or pamphlets, can be very helpful. I encourage questions and ensure the patient feels comfortable voicing any fears or uncertainties. Repetition and summarization of key points can reinforce their understanding, and I make sure to check back with them to confirm that they grasp the information provided. 13. How do you build rapport with patients? Building rapport with patients involves active listening, empathy, and open communication. I strive to make a personal connection by introducing myself and expressing genuine interest in their concerns. I use nonverbal cues, such as maintaining eye contact and nodding, to show that I am engaged. It's essential to validate their feelings and provide reassurance when necessary. By respecting their individuality and cultural background, I create a safe space for patients to share their thoughts. This approach fosters trust, making patients feel valued and more comfortable during their care. 14. How do you maintain patient confidentiality? Maintaining patient confidentiality is crucial in nursing. I ensure that sensitive information is shared only with authorized personnel and only when necessary for patient care. I am diligent about securing patient records, both physical and electronic, and I follow strict protocols for discussing patient information. During conversations, I make sure to choose private settings to avoid being overheard. Additionally, I educate patients about their rights regarding confidentiality and the measures in place to protect their information. This builds trust and reassures them that their privacy is respected. 15. Describe a time you had a conflict with a coworker. How did you handle it? In a previous role, I encountered a situation where a coworker and I disagreed on the approach to patient care. Tensions rose during team meetings, impacting our collaboration. I decided to address the issue directly by requesting a private conversation with my coworker. During our discussion, I actively listened to their perspective and expressed my concerns calmly. We found common ground by focusing on our shared goal of providing the best care for our patients. This experience taught me the importance of open communication and compromise in resolving conflicts effectively. 16. How do you communicate effectively with doctors and other healthcare staff? Effective communication with doctors and other healthcare staff is essential for providing high-quality patient care. I prioritize clarity and conciseness when sharing patient information, ensuring that I provide pertinent details without overwhelming my colleagues. Active listening is crucial. I make sure to fully understand their instructions and concerns. I also utilize appropriate channels of communication, such as electronic health records and team meetings, to facilitate collaboration. Building strong relationships through mutual respect helps create an open environment where we can discuss patient care freely, ultimately leading to better outcomes. 17. How do you contribute to a positive team environment? In my nursing practice, I foster a positive team environment by actively engaging with my colleagues and promoting open communication. I make an effort to acknowledge and appreciate each team member's contributions, which boosts morale and encourages collaboration. I also participate in team meetings and share insights or suggestions that can enhance our workflow. By being approachable and offering support during challenging times, I help create a culture of teamwork and respect. Ultimately, I believe that a positive environment leads to better patient outcomes and a more fulfilling workplace for everyone. 18. How do you respond if you notice a colleague making a mistake? When I notice a colleague making a mistake, I first assess the situation to understand the impact of the error. If it poses a risk to patient safety, I address it immediately and calmly, either by intervening directly or notifying the colleague discreetly. I approach the conversation with empathy, focusing on collaboration rather than blame. It's important to create a supportive environment where we can learn from each other. After addressing the immediate issue, I may suggest a review of protocols to prevent similar mistakes in the future. Open communication is key to maintaining a safe and effective healthcare setting. 19. Describe a time when you had to handle multiple high-priority patients. In a busy emergency department shift, I encountered a situation where I had 3 high-priority patients needing immediate attention. One was experiencing chest pain, another had severe respiratory distress, and the third was a trauma case from a car accident. I quickly assessed each patient's condition, prioritizing the chest pain due to the potential for a cardiac event. I delegated tasks to my colleagues, ensuring the trauma team was alerted while I stabilized the respiratory patient. By maintaining clear communication, we efficiently managed the situation, providing timely interventions that ultimately improved patient outcomes. 20. Share an experience where your quick thinking helped a patient. During a busy shift in the emergency department, I encountered a patient who suddenly went into cardiac arrest. Recognizing the situation immediately, I quickly initiated CPR while calling for help. I managed to maintain composure and effectively communicated with my team to grab the defibrillator and prepare for advanced life support. Within minutes, we were able to restore the patient's heartbeat. My quick thinking and swift actions not only saved the patient's life but also reassured their family during a highly stressful moment. It reinforced the importance of teamwork and preparedness in critical situations. 21. Have you ever had to advocate for a patient's care? What did you do? Advocating for a patient's care is a vital part of nursing. One instance involved a patient who was not receiving adequate pain management after surgery. I noticed they were in distress, so I approached the attending physician to discuss the situation. I presented the patient's pain levels and concerns, emphasizing the importance of effective pain control for recovery. After discussing it further, the doctor adjusted the medication regimen. The patient expressed gratitude, and it reinforced my commitment to ensuring that every patient's needs are met and heard. 22. Tell me about a time you made a mistake. How did you address it? I once administered a medication to a patient without double-checking their allergy history, which resulted in a mild allergic reaction. Immediately, I informed the attending physician and the nursing supervisor. I monitored the patient closely and provided appropriate care to manage the reaction. After the incident, I took responsibility, discussed it with my team during a debriefing, and reviewed our medication administration protocols. This experience reinforced the importance of thorough checks and communication in patient safety, prompting me to be more vigilant in my practice. 23. What are your certifications and specialties? I hold several certifications that enhance my nursing practice, including Basic Life Support, BLS, Advanced Cardiovascular Life Support, ACLS, and Pediatric Advanced Life Support, PALS. Additionally, I specialize in critical care nursing, which has enabled me to manage complex patient cases effectively. I am also certified in wound care management, allowing me to provide specialized treatment for patients with chronic wounds. Continuing education is important to me. I regularly participate in workshops and professional development courses to stay current with best practices in my specialty areas. 24. How do you stay updated with nursing practices and medical knowledge? I stay updated with nursing practices and medical knowledge through various methods. Attending continuing education courses and professional workshops allows me to learn about the latest advancements in healthcare. I subscribe to reputable nursing journals and participate in online forums and webinars, which provide insights into evolving practices. Networking with colleagues and joining professional organizations also keeps me informed about changes in guidelines and best practices. Regularly reviewing evidence-based literature is essential for maintaining high-quality patient care and ensuring my skills remain current. 25. Why do you want to work at this hospital, clinic? I am drawn to this hospital, clinic because of its strong commitment to patient-centered care and its focus on community health. I admire the innovative programs you offer, particularly in chronic disease management, which align with my passion for helping patients achieve better health outcomes. The collaborative environment here fosters professional growth, and I believe that working alongside dedicated healthcare professionals will allow me to enhance my skills. I am eager to contribute to your mission of providing exceptional care and making a positive impact on patients' lives. As you prepare for your nursing interviews, understanding these top 25 questions and their answers can significantly enhance your confidence and performance. Each question is designed to help you showcase your skills, experiences, and passion for nursing. Remember to personalize your responses to reflect your unique journey and qualifications. We hope this guide serves as a valuable resource in your interview preparation. If you found this video helpful, please give it a thumbs up and subscribe for more insightful content tailored for aspiring nurses. Your support is greatly appreciated.